From Rocky Mountain PBS News, this is Colorado State of Mind. Tonight, why is it that babies born to Black Colorado families are more likely to die before their first birthday than those born to white families?
We have one of the worst infant mortality rates in the world of industrialized Western nations.
The glaring racial disparities in a measure that is seen as a key indicator of any country's health.
It's like our little black secret. Black babies die at 3 to 4 times the rate as our counterparts.
And for Latino families, the infant mortality rate has been on the rise. How Colorado's Nurse Family Partnership and other efforts are aiming to prevent such precious loss.
The biggest benefit is to know that I'm doing right by my daughter.
Good evening, I'm Cynthia Hessen. Tonight, Rocky Mountain PBS News builds on our investigative reporting in Losing Ground and Standing in the Gap as we continue our initiative on race in Colorado, telling the stories of diverse families of color and looking at disparities that persist between white residents and Black and Latino residents. In Losing Ground, we focused on economic factors like family income and home ownership and showed how Colorado actually became a less equitable place for its minority residents after the civil rights era of the 1960s. Our Standing in the Gap report on student achievement in public schools traced the history of desegregation in Colorado and revealed that Denver is once again racially segregated. Tonight, we turn our attention to disparities in health, beginning with one of the top measures of any community's health, the infant mortality rate. Joining me now is Katie Wilcox, Rocky Mountain PBS reporter and producer, who's leading this next portion of Race in Colorado as we shift our attention to health. Katie, when it comes to infant mortality, there is an overall number, and then there are the numbers as broken down by race and ethnicity, and that's where the surprising story is.
That's right, Cynthia. Colorado has the 5th lowest infant mortality rate in the country, but that's definitely not the whole story. The infant mortality rate measures the number of infants born alive who die before their first birthday out of every 1,000 born. In Colorado, fewer than 6 infants of all races die before their first birthday. But when we look at the racial breakdown, harsh inequities are revealed. Among others, I talked to Dr. Lauren Smith of the National Institute for Children's Health Quality.
Overall, the rates of infant mortality for the United States have gone down over time, which is a very good thing, and we should celebrate that. The crux of the real remaining problem is that there's such significant disparities in our different populations.
Dr. Lauren Smith has been a pediatrician in Boston for 20 years. She heads a national campaign to reduce infant mortality in communities of color.
So despite the fact we have, some of the best medical care and health care in the world, we have one of the worst infant mortality rates in the world of industrialized Western nations.
In Colorado, this is what those statistics mean. Black babies die at rates as high or higher than those in about 100 foreign countries. And that includes places like China, Colombia, or even war-torn Libya, according to the CIA and World Bank. Demetra Sariki is concerned about those high rates. She's a midwife, and she runs this small clinic in Colorado Springs.
When I chose my OBGYN, I couldn't find an OBGYN that was like me. There wasn't a Black female OBGYN.
Now she works with patients from rural areas and minorities to access prenatal and postpartum care.
And they also need to see a woman of color who can relate to the problems and struggles that they go through every day.
Sariki wants her patients to do everything they can to give birth to a healthy baby who will survive.
Women never forget their births. They never ever forget, whether it's a loss or a live birth, they never forget their births. It is a footprint in their heart for the rest of their life.
A complicated pregnancy made footprints in her heart. She carried her baby to 11 weeks, but miscarried.
I felt like, this is a life. I am excited, I am happy, and looking forward to all the stages of pregnancy, and then feeling like I was robbed.
Now, Sariki provides pregnancy workshops. She wants to help new and expecting mothers understand some of the health risks that they face.
Black babies die at 3 to 4 times the rate as our counterparts. That's an education issue that nobody in this community wants to talk about. It's like our little black secret.
It's a secret that's clearly revealed in the records from the state health department. About 4 white babies die in Colorado for every 1,000 white babies born. For Hispanics, that number jumps to about 7 deaths for every 1,000 babies born. And Black families lose nearly 12 babies out of every 1,000 born before that child can even have a first birthday. Now let's talk about this with 3 Colorado health professionals who can help answer why American babies, particularly minorities, face a higher rate of infant death than their counterparts in other Western nations. Joining me are Dr. Larry Wolk, Colorado's Chief Medical Officer, who heads the state's Department of Public Health and Environment; Cerise Hunt, the Interim Director of the Center for Public Health Practice at the University of Colorado Anschutz Medical Campus; and Neal, the Director of the Colorado Nurse Family Partnership, a community health program which partners vulnerable first-time mothers with registered nurses who do home visits throughout their pregnancy, birth, and their first or 2 years of life, the child's life, to help address some of these health impacts of poverty. Dr. Wolk, I'd like to start out with you and kind of explaining to us why infant mortality is such an important indicator of health and what we can learn from monitoring infant mortality.
Well, it's important because it's really kind of an end result. Unfortunately, death or chronic disease outcomes or whatever are things that we study to try and gauge the health of the community. Infant mortality is one, though, that really highlights the disparities, especially when you talk about the differences by race. And if you peel the layers of that onion back, you can see that poverty has a lot to do with it. Access to healthcare and healthcare services is then related to poverty, which is then related to how many minorities live in this state and in the country. And so infant mortality is really such a great example of a health outcome that really depicts this health inequity, if you will, that exists amongst people.
And Cerise, I'd like to bring you in on this too. When you and I spoke on the phone last time, we talked about all of these data, and a lot of it is sort of upsetting, but you said you're not all doom and gloom about it. So why don't you tell me a little bit of why you have a kind of positive outlook?
Well, I look at it more as an opportunity. I think that, Colorado is trying to be the healthiest state in the nation. And when we look at infant mortality, my focus is primarily within Black women who has the highest rates. What's unique about this is we can't just look at poverty or socioeconomic, because even with high income Black women, there are still higher rates of infant mortality. So we really need to begin thinking, and so I look more at the opportunities. How can we build upon the strengths within the community? There's a lot of great work in Colorado through the Colorado Black Health Collaborative, through the Healthy Start Grant, which has initiated the Community Action Network, through the work of the Center for Public Health Practice, where we're really partnering with community to really begin changing the narrative around these poor health outcomes, to really say, let's start talking about preconception health. Let's start talking about forming a lifetime of optimal wellness, and our community partners are all on board. And so I think, so it's not so much that I'm looking at the opportunity to change, and how can we have this data, we know the impacts, but how can we partner and use like a cross-sector approach where, the Community Action Network is built up of the state health department, we have local health, we have academic institutions, but even building that to our community partners like the Colorado Black Health Collaborative, we have Families for a Resource Center that are all collectively coming together with community residents. We have moms at the table that are saying, let's begin partnering together. Let's create a shared vision around infant mortality, specifically of how can we eliminate in Colorado, and then really creating this lifetime of wellness for the Black community, making sure that we're building on the strengths of Colorado's Black community.
And that's something that you mentioned, this infant mortality rate shows inequities, but it also helps us understand more about maybe other types of things that can influence your health, maybe substance abuse or smoking and things like that. What other kinds of things can we glean from infant mortality data?
Well, again, is infant mortality a symptom of something greater? And so that's why we are now focused on these social determinants of health. Does race have something to do with predisposing you to certain types of health conditions or what you're going to die from? Does socioeconomic status, people who live in poverty, what are they more likely to suffer from as far as preventable illness or disease? We have a suicide problem in this state that is still difficult for people to really hone in on. What we do know is honing in on those social determinants has a much greater impact than what I as an individual doctor can accomplish in my own clinic or office, which is why, to Cerise's point, we really need to pull together the healthcare delivery system, the public health folks, the researchers, and then folks outside of that health box, business and folks in the community who are contributing to the economic development of the community.
And Michelle, I want to bring you in. I know that the Nurse Family Partnership works with a specific group of women, so first-time mothers who have low income. Why do you work with that specific group of women?
Well, like you said, we focus on women, especially vulnerable women that are pregnant with their first baby. That's a unique time in a woman's life to really learn preventative health behaviors. And with our program, we're helping those behaviors stick for a lifetime and have really shown multi-generational effects. So we are really working to help our clients and their families chart their own way out of poverty. And like Dr. Wolk said, it's a complex issue, and our nurses really get into the nitty-gritty of what it's like living in poverty. They're in the homes with the clients. It's more than not having enough money. It's that you probably have a low-paying job that's not stable, that you don't get good access to health insurance, so you might not have good access to health care or continued health care with the same doctor every time. You might not have resources to get basic needs like dental care, and pregnant women that doesn't get dental care can have higher risk of preterm birth, which leads to infant mortality sometimes.
And I actually got an opportunity to speak with some of the women who are involved in your program. Guadalupe Martinez is a senior in high school down in Pueblo, as is Justenia Beltran, and she's had her baby since I saw her last. And Alicia Whitmill lives here in Denver with her daughter Zariah and Zariah's father. She had to put college on hold, but she plans on going back. So let's hear how the Nurse Family Partnership is working for these moms. First, Alicia and her daughter Zariah.
Wait, so you're telling me that I can have a nurse come in every week and she can help me out and, she can, just kind of guide me through, tell me things on what to do, what I should do, how I should do it, I don't know, with me being a stay-at-home mom, with me being a first-time mom, I honestly don't know how I would have gotten through without Lucy.
Beautiful. She helps me a lot. She gives me all kinds of information. Every time I have a question, she'll always answer.
You stay there.
So, things in life that cause you stress. Tell me about those again.
Just finish my school. That's kind of really important, so that way I can give him a better life and show him that, and show other people that I can do it and they can do it too. I want to prove to people I did it.
And you're so capable of doing it. You're so bright. And
Thank you.
Yeah, you're going to be able to do it.
Yeah, I really hope so. Thank you.
Yeah, you're such a good mama.
So what we heard from these mothers is they all pretty much want the same thing. They want better lives for their kids and also for themselves. They want to finish high school, they want to go to college, they want better jobs. Michelle, I wanted to ask you, how exactly does the Nurse Family Partnership measure what is success in this program? And what are the likelihood that these moms will get to graduate high school and go to college? Are those things you measure?
Well, the Nurse Family Partnership is based on over 40 years of research, both randomized controlled trials and longitudinal evidence. So we try to do the Nurse Family Partnership in Colorado communities as close to the same as it was done in the research. So we have a lot of process measures to make sure we're doing it the same. We want to get really great outcomes that were gotten in the research trials that have to do with preventing infant mortality. Things like moms that got Nurse Family Partnership versus moms that didn't get Nurse Family Partnership. What we saw with the nurse visited moms is those children had more than 50% less incidence of child abuse and neglect. In those kids, we saw more than 50% less visits to the emergency room, poisonings, and accidents. And then when you follow those children into school at age 6, they had much fewer, 2/3 fewer behavioral and intellectual difficulties than their peers did. So those long-term outcomes are what we're really striving for. In Colorado, we also measure some shorter-term outcomes. So we're really proud to say that over 90% of the babies born in nurse-family partnership are born full-term and at a healthy weight, which sets them up for good health later on. Our moms are stopping using tobacco, drugs, and alcohol, and all of our moms get screened for depression. Those moms that need mental health, where our nurses are trying to connect them into resources in the community. Once the baby's born, 95% of our moms are breastfeeding, which helps the babies be more healthy. And it's quite an accomplishment when you think of like a 15-year-old dedicated to breastfeeding when she has to go back to school 2 weeks after she had her baby. Those kids, we're seeing that the 95% of them are immunized by the time that they're 2 years old, and that compares very favorably to the Colorado population at large, which is much less than 95%. All of our kids get developmental screening so that they get into early care, early screening for any kind of developmental problems they might have as soon as possible. We also measure repeat pregnancies because we know that it's difficult to get out of poverty when you have one child, but when you have two, it's almost impossible. Only about 25% of our clients have repeat pregnancies during the program. We're trying to help our clients achieve economic self-sufficiency, and so that has to do with planning when your next pregnancy is. It also has to do with staying in school or getting back into school and getting a job. And so we also monitor that. So we look at clients who might not have a high school diploma when they come into the program, and our nurses try to help them figure out how to get childcare if they need it and finish their school. One thing we're really excited about is now we have a few nurses working in our program that were actually clients years ago. So they've not only finished high school, but they've gone on to higher education and are giving back to the program that they got from.
I think that's really exciting, and I think probably at least a question I have, if not probably our audience as well, how many clients do you guys get to have in Colorado, and are there counties do all counties get to participate in this?
It's available in almost every county. Colorado has 64 counties. It's now available in 61, and we're working to expand into the other counties. We actually have openings in almost every program, so it's great to get the word out that we have this program here, and most of our referrals can come through application to Medicaid or schools or primary care providers, so we definitely have capacity for more clients.
And go ahead.
I was just going to say, I mean, this is such a good example of a health program that, as you heard, really addresses more of those social determinants, making sure that the moms are supported and given the tools that they need to have healthy pregnancies and to have healthy babies. It's not necessarily about the medical and nursing care. It's about making sure that they have food. It's about making sure that they have opportunities for education and for work and safe homes. We don't want to sort of look at these sort of things in isolation because people experience all of life, not just infant mortality, but all these other things. And so it's just such a wonderful program with such great outcomes because they focus on life and not just sort of that nursing or medical care.
And I would definitely completely agree. And linking people to the resources in their community, that's what I heard. And so Nurse Family Partnership is not saying it's just us who own this. We're going to connect you to this resource. That's that cross-sector collaboration that we talked about, and this resources. And then as people are supported and they're not being socially isolated, then they have that connection. They're able to go through this whole pipeline. You've created a pipeline to graduation to career. And so I think that even in our infant mortality work, we hear of mothers that feel socially isolated. I don't have these supports in my community. I don't have these supports. I didn't know of this program. And so making sure that when services are offered, that our community is aware that these important public health resources are articulated to those in need of these resources, and that they're delivered in a culturally responsive manner, which was been designed through the Nurse Family Partnership was described.
And I actually want you to tell us a little bit more about the programs that you're very involved in, like Healthy Start. Can you give a little example of what Healthy Start is?
So with Healthy Start is a HRSA project, a federal funded project that's working at a really specific neighborhood level to build these networks of support for infant mortality, specifically looking at the African American Black women. And in this program or this initiative, that they have really begun partnering with women in the neighborhood and really have advocates that are working to create these systems of support at a neighborhood level. And then in addition to that, they're bringing in that cross-sector collaboration, bringing in the Community Action Network to say, okay, let's build through a collective impact approach that common agenda around infant mortality. How can we work with the women in the community, state health department, local health agencies, academic institutions, anyone who's interested in addressing infant mortality in these neighborhoods? How can we create a common agenda, a common narrative of how we're going to address it? You're looking at the social determinants of health. And so I think that that's what's really been great. And so through the Community Action Network, we've convened. We had an African American Infant Mortality Summit this past June, really creating an awareness at a neighborhood level. And then from there, we have different groups that are tackling some of the issues that came out of the summit.
Absolutely. And the summit was where I started this project, so
Yes.
I appreciate that. So what I've heard from you, Michelle, is that sending nurses one-on-one with mothers, and from you, we have this sort of neighborhood base. Dr. Wolk, you want to talk about a broader picture for what public health can look like for the whole state?
And I think these are examples of, again, health equity rather than equality. We talk about a somewhat infamous cartoon that I think depicts this very well, and these programs really highlight that, which is imagine 3 kids of different height trying to look over the fence to watch a baseball game. In the context of equality, you give each one the same sized box to look over the fence. Well, the short kid really still can't see over the fence. The medium-sized kid really not so much, but the tall kid, sure, he can see over, and you've given them an equal box. What equity is about is recognizing that the short kid still can't see over the fence, so we give him 2 boxes. And maybe the medium kid gets a box and a half, and that tall kid still gets a box. And now you have equity. Now everybody is at the same height and can see the game. And that's what these programs and others do, and that's the public health approach, is to really look for where we can bring equity so that we can address things like infant mortality amongst the Black population or the impoverished population or a number of other health indicators, and find out who do we have to help more and how can we do that.
Thank you all so much for joining me. I know we've already run out of time. I know it goes by quickly. Thank you all for joining me. Dr. Larry Wolk of the Colorado Department of Public Health and Environment, Cerise Hunt from the Colorado School of Public Health at the University of Colorado Anschutz Medical Campus, and Michelle Neal with the Colorado Nurse Family Partnership. Next week, we'll tell you more about the unique challenges African American women face at all income levels, regardless of education. And we'll look at local research happening right here in Denver at Denver Health and explore how stress not only makes people less healthy, but might be a significant factor in endangering the lives of newborn Black infants.
That is absolutely consistent with national data as well, that even if you take the wealthiest Black woman, her rate of preterm birth is still higher than the poorest white woman.
The numbers are equally true for education levels.
A Black woman who's been to college could have the same likelihood of having a bad outcome in terms of her pregnancy as, say, a white woman who hasn't finished high school. So the benefits that accrue to education and increased income aren't felt equally by all groups in our country, and we have to understand some of why that is.
So why is it that women who are otherwise achieving in the culture, well-paying job, climbing the career ladder, otherwise seeming to do well in this society, would have such high infant mortality rates?
At Denver Health, Dr. Camille Hoffman thinks she can find the answer in clippings of hair from patients like Adora Loftus.
Our assumption is that African American moms have higher levels of stress, and that may be part of the relationship with preterm birth in that population.
We'll also hear how Colorado wants to lead the nation in understanding this phenomenon, and how healthcare providers want to change practices in hospitals and in the community, not to simply decrease the disparity, but they say to actually eliminate it.
Thank you, Katie. Such a great job tonight and interesting discussion with all of your guests. That is Colorado's State of Mind for this evening. Join Katie Wilcox next week for more on precious loss, part of our Race in Colorado series from Rocky Mountain PBS News. I'm Cynthia Hessen. Good night.